Hi everyone, welcome to my YouTube channel My Health and Me byfun. Please like, subscribe and share. Today we will be talking about testicular disorders. First, we will talk about epididymitis. Epididymis is that little coiled tube behind your testicle that acts as a highway for sperm. When it becomes inflamed, it is called epididymitis. It is often caused by bacterial infections. Sexually transmitted infections like chlamydia or gonorrhea. Urinary tract infections can also be a culprit. Symptoms to watch out for include pain and swelling in one testicle, redness or warmth in the scrotum, and pain when you pee. There could also be fever or chills. Next up is orchitis, which is inflammation of the testicle itself. It often teams up with epididymitis or pops up after viral infections. Untreated epididymitis can also lead to this. It is caused by the mumps virus, especially in guys who didn't get vaccinated as kids. Symptoms include a swollen, painful testicle on one or both sides, fever, and generally feel wiped out with body aches. Mumps-related orchitis can mess with your fertility down the line. That's why getting vaccinated is good. Prevention is key. Moving on to hydrocele. It's a buildup of fluid around the testicle that feels like a smooth, soft swelling in the scrotum. It's super common in newborns and usually resolves on its own, but in adults it can happen after an injury, infection or surgery. The main symptom is a painless swelling in the scrotum, maybe with a bit of a heavy feeling. Not usually a cause for panic, but if it is big or sticking around, a minor surgery might be needed. Ever heard of varicose veins? Well, a varicocele is basically that, but in the scrotum. It happens when the veins above the testicle get enlarged. It can be a bit uncomfortable, causing a dragging sensation. It has been linked to infertility in some men because it can affect sperm quality. Symptoms can include a feeling like a bag of worms when you're standing and swelling or discomfort, especially after exercise. The good news is that it doesn't always need treatment, unless it's causing you pain or messing with your plans for fatherhood. Let's talk about testicular torsion. This is a medical emergency. It happens when the spermatic cord, the lifeline that carries blood to your testicle, gets twisted, cutting off the blood supply. It is most common in teenage guys and young men, often during puberty. This can happen after an injury or even in your sleep. Symptoms hit hard and fast. Sudden severe pain in one testicle, swelling, and you might even feel nauseous or vomit. There is a window of about 6 hours to get this treated before permanent damage occurs. So if you even suspect testicular torsion, get to the emergency room immediately. Testicular cancer. It tends to affect younger men, usually between 15 and 35 years old. It is not super common, but it is highly treatable if caught early. The most common sign is a lump or swelling in one testicle. This usually doesn't hurt, but you might feel a heaviness in your scrotum or a dull ache in your lower belly or groin. This is where self-exams come in. Get familiar with what's normal for you down there. Doing monthly self-exams can help you catch any changes early on. If you notice anything unusual, don't brush it off. Talk to your doctor. The more you know about your body and the potential issues that can pop up, the better equipped you are to take charge of your health. If you found this helpful, give us a like, subscribe, and share.